Hello, Downey. I am your Mayor Claudia Frometa. I want to deliver a special message of New Year's Eve, New Year's Day. I know it's been a difficult year for all of us, but I wanted to reach out to you as a community with a plea. As you think about your New Year's Eve plans, I want you to consider where we are as a community and the repercussions that gatherings may have in our healthcare community. I am honored to be here this afternoon with Dr. J.T. Lee from Kaiser Permanente Downey to my right, and Dr. Jasmine Shah from PIH Downey to my left. Also joining me is our incoming fire chief, Dan Herlock. The reason, Downey, we are here today is because our healthcare system, our hospitals are on the brink. We've had a difficult year dealing with a pandemic. And as you know, we have had lockdowns. We are just experiencing a continuous surge upon a surge. And it is important for us as a community of 113,000 residents, the 11th largest community in Los Angeles County, to think about how we are going to contribute to help these hospitals manage the surge. Dr. J.T. Lee, would you please join me and say a few words for our community?
So good afternoon, fellow Downey community. A lot of times people ask me, how is it going in the hospital? I can only tell you what you see in the newspapers, what you've seen in the media. It is true. We are doing everything we can to treat as many patients as possible. Yes, we are almost at capacity in many of our areas, but this is something that many of you have seen. Many of you also have heard that a lot of our staff are tired, but they are there. They're going to do whatever it takes to take care of all of you. Whatever happens to all of us, I want you to know there are also intangible pieces to what we experience in the hospital. Something you may not have heard before, that many of our physicians and staff, they feel sad. They're very sad for the family members who will not be reunited with those outside the hospital. They are very sad for all the other patients. They're very sad for the staff and the physicians every day who have to talk to our members, our patients, about where the next steps are in the care of their family members. What I really love about practicing medicine at Downey is Downey's about family. It's a community. We have third, fourth, first, second generations coming together during the holidays. As our mayor just told you, please, please do everything you can to keep it to one generation of family members that are immediate this holiday. Please do that. You will hear social distancing and washing hands everywhere, but for us, here at Downey as a family, just please keep it at one generation this year. Plan for your future today. And part of it is how we address, how we get together in the next few days. So if there's anything that you get from our message today is that we care about all of you. And we want you to celebrate all the generations moving forward, all the future years. There is hope, there is the vaccine, but at this time, we just need your help. I want to thank the mayor for giving me a chance to talk to you and share our message from our medical center. So thank you for listening.
Thank you, Dr. Lee. Downey, again, the key is in your hands. It is not about infringing upon our rights and our freedoms. It is right now about helping our community stay healthy. Our medical centers are lighthouses in our community. And Downey is fortunate to have three, two of which are 911 receiving hospitals. They treat broken bones and cancers and heart disease and strokes throughout the year. But at this very moment, every bed that is being taken by a COVID patient, every individual that is coming to the ICUs is really an opportunity for members in our community to think about what we can do together to help our hospitals. I'm going to introduce you to Dr. Yasmin Shah from PIH Downey to say a few words.
Good afternoon. My job at PIH Downey is to run the intensive care unit. And just to give you a sense of what we've seen change over the last few months since March. The first surge, we were hitting about 20 patients on ventilators and needed about a dozen beds outside of our ICU to reach capacity for taking care of patients. The second surge in June, July was the same. Right now, we are dealing with a lot more patients. We've almost tripled our ICU capacity, and we are running about double the normal amounts of ventilators we did in the previous two surges. So yes, the doctors, the nurses, the respiratory therapists, and all the staff in the hospital are ready to help take care of the patients that are coming in. We're prepared. I want to urge you to do your part in helping our community fight this coronavirus. And that's to stay home. That's to wear masks when you're out in public. That's to practice good hand hygiene. And most importantly, to stay within your family units. So that means the people that are in your household, not your cousin, not your brother, not your aunt. For especially this holiday, the peak is supposed to be sometime in February. So we have a long ways to go, but curbing those sorts of behaviors now can help bring that peak down. Thank you.
Thank you, Dr. Shah and Dr. Lee. Thank you for what you do for our community. And last but certainly not least, I invited our incoming fire chief, Dan Herlock, to talk to us about the surge that we have seen in our community in terms of call volume from a fire department's perspective. Our firefighters have begun to get the COVID-19 vaccine this week, and we are encouraged because there is light at the end of this tunnel. We will get better. There are better days ahead, Downey, but we still need to work together. Chief Herlock.
Thank you, Mayor Frometa. I have a couple of statistics I'd like to share with you related to the fire department and EMS-related 911 calls. In Downey, COVID-related 911 EMS calls have increased significantly. An example of that is the week of November 16th through November 22nd, the fire department responded to 24 suspected 911 COVID cases. And just a little over a month later, after the Thanksgiving holiday, the week of December 21st to December 27th, we responded to 55 suspected 911 COVID-related cases. So during that 2-week time frame, there was an increase of 119% in 911 COVID cases that the fire department responded to. Another statistic, according to the Los Angeles County Health Department, on 11/22, November 22nd, there were a total of 5,140 confirmed COVID cases and 91 COVID-related deaths in Downey. And on 12/27, there were a total of 10,781 confirmed COVID cases with 111 COVID-related deaths. This equals a 110% increase in cases and a 22% in COVID-related deaths, which is obviously not good. The increase in COVID cases has impacted local hospitals significantly as well. You heard from the doctors from both PIH and Kaiser that beds are filling up with patients, which means that ERs are filling up, which impacts the fire department and our 911 service. As we drop patients off at the ERs, there tends to be longer wait times, which generally could sometimes frequently end up being hours, which impacts our response time, where we have to rely on other units from adjoining cities to respond to 911 calls here in town. So I'd like to remind everybody to adhere to the recommendations of the health experts, follow the safer at home orders issued by the county and the state, and then as the doctor stated, continue to wear a mask, avoid gathering in groups, maintain social distancing, wash your hands frequently, and disinfect the things that you touch. So thank you very much.
Thank you, Chief. We hope you have a good and safe holiday weekend. Please stay safe, Downey. We will get through this together. Better days are coming. Downey strong. Thank you to our Downey Kaiser Permanente and Downey PIH. Thank you and stay safe.